Tánaiste, chronic obstructive pulmonary disease, COPD, is a major health issue in Ireland, claiming the lives of 4 people daily. It is a lung condition affecting 1 in 13 adults, hindering the movement of air in and out of their lungs and making breathing difficult. Despite its manageability, only 20% of those with COPD are diagnosed, often too late, as diagnoses frequently occur during medical emergencies. This contributes to Ireland having the highest hospital admission rates for COPD in the developed world, with nearly 2 admissions every hour, double the OECD average. While this situation places a financial strain on our health service, costing approximately €120 million annually in hospital admissions, it also puts greater pressure on hospital beds during the winter when acute COPD-related illnesses are more frequent, as these patients tend to stay in hospital significantly longer than the average patient. Reducing hospital admissions for COPD would significantly ease overcrowding in our emergency departments this winter. It's frustrating that COPD management is feasible, yet healthcare delivery falls short. Under Sláinte Care, 24 integrated care consultants were promised to manage COPD care, but only 8 are in place. General practitioners have primary responsibility for COPD care, and they were promised to be supported by 30 specialist ambulatory hubs. However, only a fraction of these hubs and the planned clinical nurse specialists in pulmonary rehabilitation are operational. Tánaiste, I must reiterate that the lack of support services leads to overwhelming pressures on our emergency departments, especially during the winter, with COPD patients occupying beds that could be avoided with better community health care. Moreover, the socio-economic status significantly contributes to COPD outcomes in Ireland. The risk of dying from COPD is as high due to poverty as it is to smoking-related causes. Furthermore, there's a staggering 366% disparity in COPD mortality rates between that of a barrister and that of a bricklayer. Factors such as poor housing, low income, limited access to healthcare, types of employment and environmental conditions disproportionately affect those with COPD from lower socioeconomic backgrounds. Tánaiste, we must prioritise community-based COPD care within our health service in the interests of all our patients.
Thank you, Deputy. Tánaiste.
First of all, I'm going to thank the Deputy for raising this very important issue. And historically, Ireland has had very high prevalence of COPD, and there can be different factors, even climate, and that's one factor. I think you've outlined it towards the end of your contribution, the public health framework that governs much of this, and smoking was a big factor, but smoking tended to be socioeconomic as well in terms of prevalence and scale, and so various measures we have taken as a country on smoking has helped, but there are issues around work safety in terms of dust and inhalation, and I think we have improved a lot of that compared to where we were 10 or 20 years ago. So that prevention piece is extremely important. You're correct on housing as well, and the quality of housing. So those are all areas that will help to prevent. Now, in addition to that, then you need a proper community-based model of care, and then you need an acute system of care. Now, in 2019, the HSE developed a COPD model of care, and that redefined the way health services are to be provided to people with the disease. And in November of 2021, the first national clinical guideline for the management of COPD was launched, and that's idea being the right care delivered to people with COPD at the right time and in the right place. And then the chronic disease management programme commenced in 2020 and has been rolled out to all adult GMS patients over a 4-year period. That chronic disease management programme That's an entirely new healthcare service in Ireland, has brought the care for chronic disease further into the community. Its aim is to reduce hospital attendance by patients with one or more of these specified conditions. The COPD is a specified chronic disease that falls to be managed under that particular programme. And through the chronic disease, as you've said, management contract GPs are funded to provide structured reviews and interventions in time with the model of care. Each patient receives 2 scheduled reviews with the GP in a 12-month period, each preceded by a practice nurse visit. And those reviews are to include patient education, preventative care, medication review, physical examinations, individual care planning, and scheduled investigations. And then in addition to that, to the GP chronic disease management programme, the enhanced community care programme, as you know, is a suite of strategic reform initiatives. Under that programme, about 3,500 people are being recruited, with 2,800 already recruited. 96 community healthcare networks are now operational under the enhanced community care. 24 of the 30 community specialist teams for older persons are operational, and 24 of the 30 CSTs for chronic disease management are operational. So progress has been made, Deputy. I don't doubt that more needs to happen, because it's a particularly nasty disease that can significantly hamper a person's quality of life. Thank you. We will continue to work on it.
Deputy Naughten. Taoiseach, I want to focus on one contributory factor to COPD, and that's poor housing. Now, research commissioned by the Department of Climate Action and produced by the London School of Hygiene and Tropical Medicine has shown that retrofitting of homes of those with COPD or asthma reduces their use of GP, emergency department and hospital services. A win for our climate and a win for our health services. Yet if someone in receipt of the fuel allowance applies for the home energy retrofit under the Warmer Homes Scheme today, they won't see the benefits of that until the winter of 2026-2027, 2 winters away. What is even more concerning is that those living in some of our coldest homes, the ones that are built of stone, are completely excluded from the scheme and receive no support whatsoever. Taoiseach, this is just not good enough and needs to be urgently reviewed.
Thank you, Deputy. Taoiseach.
I admired the Deputy's ingenuity and creativity from turning chronic disease management programme into a very specific grant-based, or the deficiencies of the grant-based system for retrofitting, and that's to be applauded. But I acknowledge what you're saying, and I think you're alluding to the fact that there's so many applications, and it's the capacity of the scheme to get responses more quickly. But there is no doubt, though, if you look at it compared to before this government came into power, like the contrast in the volume of retrofitting that's now going on. There's an entire new industry being created as a result of guaranteed funding over the next decade through National Development Plan that gives the industry confidence in the retrofitting area. And we do want, in particular, those in the more disadvantaged income groups to get the benefits of retrofitting as quickly as possible. And I think you've identified a very key point, which many people who are denying climate change and so on, or who are less than enthusiastic about it, there's an inextricable link between climate change and public health. So if you take fossil fuels out of cars and buses, you have a much healthier atmosphere in cities and towns where people breathe in the air. And likewise, if you do retrofitting, there are huge public health benefits for people.